Hi, I'm Laura Pankowski, and I'm going to do inserting an NG tube and removing an NG tube. So the first thing I'm going to do is I'm going to check my patient's chart, and I'm going to determine what size NG tube I need and gather my equipment. Then I'm going to perform hand hygiene, and I'm going to put on any PPE if it's required or indicated. Then I'm going to come and identify my patient, and I'm going to do so by introducing myself and then checking their wristband. I'm going to ask them their date of birth, and I'm going to ask them for their name. After doing so, I'm going to explain to them the procedure and why it's being requested, and then I'm going to ask them if they have any type of questions, and I'm going to answer any questions for them. Then I'm going to set up my table. For the purpose of the video, I already have it set up, and I'm going to raise my patient up to about elbow level of an appropriate working height. I'm going to make sure that they're in a high Fowler's position and at a 45-degree angle, and I'm going to assist them with getting to this position. Then I am going to put on gloves.
And before I put gloves on, make sure to raise the glass to an appropriate working height and close the curtains and the windows.
Okay, and once I have my gloves on, I'm going to take the abdominal covering and I'm going to place that over them. And I'm going to give them an emesis basin. And then I'm also going to give them tissues for the procedure as well. And I am then going to start the procedure. So I will take the tube itself, and I want to measure the tube from the tip of the nose to the earlobe. I'm actually going to go around to give myself a little bit more room to the earlobe. And then I'm going to go to the xiphoid process. And then I'm going to mark this spot here with either a marker or some tape. It looks like it's already marked on here, but I'm also going to mark it as well so I can see where it's marked. All right, there we go. And then I'm going to place this into my lubricant. And I want that about 2 to 4 inches for insertion. The next thing I'm going to do is I'm going to offer them any kind of topical treatment for their nose just to make the process a little bit easier. All right, then I've got that in. The next thing that I'm going to do is I'm going to make sure I have water handy for them. I might have somebody with me, so they might hold it for my patient. So the next thing I'm going to do is I'm going to have my patient have their head flexed against the back of the bed, and I'm going to explain to them that this is going to go through their nose. I'm going to ask them to test which nostril is better to use. So they'll, put a finger to their nose and blow in and out. Whichever one is stronger is the one we're going to use. So for the case of this patient, it's going to be their right nostril. So then for inserting the tube, I'm going to insert the tube. And once I feel some resistance and it's hitting the pharynx, I'm going to have my patient put their chin to their chest and drink water and keep drinking water. All right, and if they start to cough during this process or gag, something like that, then we would stop the procedure immediately. We don't want the patient to have a complication. This particular mannequin hopefully will get me all the way to this tape. They're still drinking water at this point. Sometimes you might have to turn to get it all the way in. I think this might be as far as it's gonna go on the mannequin. In real life, this would be a little smoother with the mannequin not fighting me. But like I said, small turns here and there. Okay, we're about to the tape. And I can no longer get this into the mannequin. So in real life, this would be, you can get it, okay. It should be to the tape. the mannequin will not allow me to get any further and it's pushing it out, but so it would be to the tape. So the next thing we're going to do is we are going to open up our irrigation tool. And we want to test our placement by doing this. So make sure the lid is off. We're going to test the placement of our tube. So I want to get some of the contents and make sure that it's correctly in the stomach. So I'm going to attach this and I'm going to pull some out, and I'm going to look for the coloration and to make sure I have the correct spot in the body. And I'm going to put that back in. This would be unclamped. And then I am going to clamp this up, remove this, and I'm going to test this on a pH strip. So I'm going to test that on this makeshift pH strip. So I'm going to put a drop on that, and then I'm going to compare it, make sure it's in, a good color. I'm going to dispose of this. I'm going to actually push that back in there and clamp it, dispose of this. And then I'm going to attach it to the suction. And then we can unclamp that. Okay. We're going to attach that to the suction, like I said. And then we're going to measure the length of the tube after it's been placed now. So we're going to measure it from where the tape would be to the xiphoid process. So that's about 14, 15 inches. I would have put a piece of tape on the nose while I did that. I just forgot to do so in the video. So now I'm going to secure the tube since it's in the right position. I'm going to ask my patient if they're comfortable. Are you comfortable? And then I want to get about a 4-inch piece of tape, and I want to rip it down the center here. And we're going to apply a nose protectant, so that I would apply my nose protectant, to their nose, and we're going to tape this. Kind of cut a bigger piece of tape than I needed, so we're just going to fold it over for a second. We're going to tape that to the patient, and we don't want the tube too tight, so we're going to do a little swirl wrap so that it stays. Going to ask them if they're comfortable again, and then we're going to make sure that we have the patient turn their head both to the right and to the left before we attach the tube with a pin and a clip. So we want to pin this to the patient.
So that the wet gauze isn't touching any of the skin, because once it touches the skin,
and then we want to attach this so that they still have, a range of motion to move their head. And then that's attached to the suction. So we are going to turn the suction on. Ask them if they need any tissues. We're going to dispose of this in the facilities where the facility would like. So we're going to clean this all up. Dispose of this. For the purposes, I'm going to save it. I'm going to dispose of my gloves at the same time. I'm going to perform hand hygiene. I'm going to ask my patient if there's any oral care I can help them with or anything else I can do for them. After doing so, oral care will be every 2 to 4 hours as needed. I'm going to remove my PPE, and then I'm going to return the position back to a normal height, raise the railing back up, and the insertion process is done. So coming back, now I'm going to have to remove the tube from my patient. So we're going to do about the same thing I did before. I'm going to address the client's chart to see what I have to do, what's ordered. I'm going to perform hand hygiene. I'm going to wash my hands. If I have to put on PPE again, of course I'll put on PPE. I'll identify my patient again by their wristband. And then I'm going to explain, the process of removing it and why we're removing it. Once the patient understands, I'm going to ask, if they have any questions. After their questions, then we can start the process. So again, I've got my table set up, and I'm going to, for purposes of this, I did not use this, so I'm just going to fix this real quick. So to remove this, I am going to put on gloves.
Write my initials, date and time on one of the
So I've got my gloves on. And again, I'm going to put a protective pad or a bath towel over my patient. So we're going to do that. I'm again going to give them a basin, and I'm going to give them tissues for the procedure. And then I'm going to, I want to make sure that I have this already open to get my syringe out. For if I have to do a flush, an optional flush, I want to have that handy. So I'm going to turn off the suction, and I'm going to clamp this and remove the suction. Make sure that they're doing all right still. And I'm going to take my syringe. I'm going to take some of my either sterile water or saline out of here. And I want to flush that with about 10 milliliters. Make sure there's nothing coming out of it, things of that nature. I'm going to take it again and clamp it. I'm going to dispose of this in a necessary where the facility requires. I'm going to make sure that I take the tape off of the patient's nose, ask them if they're still doing okay. Then I'm going to ask them if they can hold their breath for me. And I kind of want to coil this up into my hands. I want to remove this clip and the rubber band as well, so that the tube's no longer attached to my patient. Okay, and then I'm going to have them hold their breath, so I'm going to instruct them, please hold your breath while I remove this. And I'm going to try to do this in a very quick manner. Okay, and then we're going to put that into the pad. You still doing all right? I'll keep tissues on them in case they need them. And then I will remove all of this, toss this away. I'm going to save it for the video, like I said. I'm going to remove my gloves. I'm going to offer them any type of oral care if they need, offer them tissues, see if there's anything else that I can do for them. If they want me to, clean them up in any way or give them some form of aid, then I will. And then I will, again, perform hand hygiene, put them back to their normal position, because originally when I came in, I put them back into Fowler's, back at the 45 degrees. I have my elbow height for working. So I'm gonna put them back down at, the lower level. I'm gonna raise up their bed railing, and then I am good to go, as long as I wash my hands and remove any PPE I might have had on.